Where is your question? Right. So if you have read and understood, considering it critical care scenario, kindly tell me, how would you manage the patient?
Okay. Since the patient is in the first post-operative day, I will manage her at first by the CRIS protocol.
Okay.
And start by checking the airway, whether it
Yes.
is patent or not, and then we'll check the respiratory rate, the rhythm and pattern and depth of breathing, because if the patient is in pain, this will hamper her respiratory function.
Yes.
And we'll check the circulation by checking tachycardia. And also we should not assume that tachycardia is only due to lack of analgesia, because other condition is also possible. And
Okay.
also
What other
and
conditions would you consider as a differential diagnosis to pain
since the
for
patient is
this?
in the first
Yes.
since the patient is in the first post-operative day, it could be pain in the wound region. uh,
It's the
this
same.
could
Pain
be,
is pain. Okay. And
yeah.
or what else
um
could there be? What else? What are the differential diagnoses that we'll consider?
it could be due to hypoxemia resulting in myocardial infarction,
Okay.
maybe.
Composed of complications. Yes.
Okay. And it could be due to infection, or uh, tachycardia could be due to infection as well.
Okay. Tachycardia. Yeah.
Yeah. Then we'll check if there is hypertension or not, and I will assess the patient's consciousness level, because it could be an early indicator for opioid toxicity. And
Okay.
after doing this, I will uh, if there is any pain management team will discuss with the team for the
How would
treatment.
you sorry, I have to break you down. How would you reassure that since the patient is taking paracetamol and COX-2 inhibitor, how would you make sure that patient is not suffering from paracetamol overdose?
uh,
How would you
by
assess? Yes.
The patient may have a nausea, vomiting, then a dizziness, hypotension, and the patient may also have liver function, uh, deranged liver function. uh,
Okay. Can
and
you also tell me, uh, can you please also tell me, how would you manage the pain of the patient? Have you heard of
uh,
the, yes, pain ladder, WHO's pain ladder? Can you explain that?
Yes, I will start by giving a simple analgesics like paracetamol or NSAID, then escalating the drug to opioids like tramadol or
If patient
codeine.
is not responsive, then yes.
Yes, if the patient is not responsive, and still if not responding to this drug, will escalate into a strong opioid like morphine.
All right. Can you explain the pain pathway to me, please?
Yes, when there is a tissue damage, the
Yes.
nociceptor, it travels through the dorsal horn of the spinal cord, into dorsal horn of the spinal cord, and then go to the lateral passes through the uh, delta delta fibers, for the sharpening, or slow fibers passes through the C fibers, and slow pain passes through the C fibers and then going into the lateral spinothalamic tract,
Yes.
and from the lateral spinothalamic tract and then goes to the thalamus
Tomato. Yes.
via the second order neuron, and then to the somatosensory cortex, that is the third order, then ascending and descending pain into the pre-oidoctal uh,
Okay.
periodoctal duct.
Can you name any pain scoring system that you know of?
Yes, this is it could be verbal descriptor indicator or
Yes.
visual numerical rate scale,
Yes.
Wong Banker faces for children. It could
Yes.
be fundamental, also functional assessment, and visual analog scale.
Okay.
Yes, and
Uh,
this could be done
can
by
you mention
whether
any, yes, non-pharmacological methods that can be used to manage the pain?
um, on pharmacological method. Um, um, can I get back to this later?
Yes. Okay. You said if you suspect with the liver function test that patient might be suffering from paracetamol overdose, then how would you manage that?
Okay, if the patient has administered within the first 60 minutes, we'll do gastric lavage. And if it is between 30 minutes to 2 hours of ingestion, we'll give activated charcoal.
Yes.
And still, if it doesn't work, then we'll go for antidote, that is N-acetylcysteine. And the last resort would be liver transplant if there is any acute liver failure.
Do you know what patient-controlled analgesia is?
Yes, this is an electronically controlled pump, infusion pump, which,
Yes.
which is connected to the IV of the patient for the administration of a bolus dose of analgesia, usually morphine. And this is usual to prevent overdose.
Yes.
The frequency and the dose is limited, and also it has a one-way valve, thus preventing the backflow of the analgesia into the infusion chamber. And also there is a lockout time during which pressing the button will inhibit
All right.
further administration.
Thank you. Can you tell me three complications or three side effects of using patient-controlled analgesia?
Yes, there could be. This is the patient has to be alert, and the patient handicapped individual cannot use it, and this limits the mobility of the patient, and there may be run out of the instrument can go run out of battery.
Yes.
Um, yes, that's it.
Okay. Right. Can you tell me, in this particular patient post-op day, what what are the other alternatives that you can give in order to manage her pain?
Okay, I can. If this doesn't work, then we'll give uh, epidural anesthesia may be given
Yes.
to the patient.
Good. All right. Okay. What are the measures or what are the precautions that you have to keep in your mind while giving epidural block?
Um, Precautions.
If patient is
Can I
already
get?
in pain, yes. So you already know the answer. I'll just walk you through. You already know the
Okay.
answer. Patient is in pain and patient is
Yes.
post-operative, right? So
Yes.
what kind of shock uh, is or patient can be in?
In neurogenic. No. Hypovolemic shock.
Okay, and if you are giving epidural block, what else can happen?
Um, pass. I'm sorry, ma'am. I cannot
Okay, we'll
answer this.
discuss. That's all right.
Yes.
You already know the answer, but it's just that you're stressed out.
Okay, ma'am.
Okay, good. Thank you.